Today, we're going to talk about why you should stay home while you wait for your COVID test results, what to do if you're test positive or you're exposed, and why we're seeing a high demand for testing and what that means with testing turnaround times. We are with the UG Public Health Department. My name is Janelle Friesen. I'm the Public Information Officer.
And I'm Dr. Erin Corriveau. I'm the Deputy Health Officer here at the Wyandotte County Public Health Department.
So, Dr. C, a lot of people are getting tested for COVID right now. What should folks do while they're waiting on their results, and why?
That's a great question. You know, we're seeing even oftentimes more than 700 people a day coming through our large testing site at 78th and State. So a lot of traffic there. You know, the reason that I think a lot of people are testing right now is people are feeling ill in our community. They're having symptoms of COVID, and they really need to find out what's going on. We're seeing that more than half of the people who come in to get tested are actually positive for the virus right now. After somebody gets a test, if you're having symptoms, you're not feeling good, it's really important that you stay home and stay isolated while you're waiting for those results. A lot of people feel like, oh, they can just go out and go about their business until they absolutely know that they're positive or that they have COVID. But at this point in time, if you've got symptoms, there's a pretty good chance that you've got COVID-19. And so it's a really important tactic right now to stay home and away from other people if you're sick. We're really trying to stop the spread of this virus, and it's becoming extremely difficult.
So you mentioned that many people have COVID right now. What should someone do if they test positive for COVID?
Also a great question. So if you test positive for COVID, again, stay home and stay isolated. There's been a lot of changes in the recommendations on how long a person should isolate. But at this point in time, we're recommending staying home and isolated for at least 5 days. Now, if you're still symptomatic and still have a fever and feeling awful at the end of those 5 days, still stay at home until you're really symptom-free or have very mild symptoms. If you don't have any symptoms or your symptoms are mild, after those initial 5 days of staying home, we want you to carefully mask if you go outside from your home or around other people for at least 5 days. And really, I'm going to just make the recommendation that right now, this disease is everywhere, and we should really all be wearing masks in public anyway. It just kind of stops the spread of the disease. Again, would help us tremendously at the Public Health Department and over at our hospitals.
Thank you for that. And so what about folks who are exposed to COVID? What should they do?
Well, it's hard not to be exposed to COVID right now. I just want to say that there's so many people who have it currently in this incredible wave that we're going through. If you think that you've been exposed to COVID, that is in the presence of somebody, you know, without a mask on, or they don't have a mask on, you know, we would definitely recommend that you go ahead and quarantine and stay quarantined then until at least day 5. We would recommend at that point in time that you come get tested at our site. And that'll help you realize, you know, hey, did I get it or not? Even if you're not symptomatic, I would just like to say, please come and get tested just in case. Now, if you do quarantine and you find that, say on day 2 or 3, you get symptoms, you've got a cough, you've got a scratchy throat, sore throat, fever, you know, come on and get tested immediately. You don't need to wait for that full 5 days.
Makes sense. And also just a reminder for those folks who test positive, let people you are in contact with know that they might be exposed, so they know to take those steps to quarantine.
Thank you for saying that, Janelle. There's a lot of people, again, who have this virus right now, and it's very difficult for us to contact trace everyone at this moment. And so each of us have to take responsibility at this time to help notify others around us. that we've been in contact with, if we are positive for COVID-19, it's just really important to talk to people who you've been around so that they can get tested, and again, that we can kind of cut the chain of transmission of this disease.
So you've alluded to this a little bit, but could you speak more to the current situation with testing in our county and the demand?
Yeah, well, we've seen unprecedented numbers of people coming to get tested. Throughout this pandemic, for now a couple years, we've seen that when we see that folks are ill in our community, when people don't feel good, testing rates go up tremendously. But we've never seen testing rates like this right now. That being said, that's okay. We want to encourage everyone, if you're not feeling good or you've been around someone who has COVID, come on and get tested. We certainly don't want to discourage anyone from knowing their status. We will be in the coming week able to distribute some home-based testing kits. And so please stay tuned for that information. It's been difficult to obtain those home-based kits, but we believe some are going to be coming into our community here within the next couple days, and we'll get those out to you all as soon as we possibly can.
Thank you for that. And I want to remind folks as well that there are some places seeing delays with testing turnaround times just because of this incredibly high demand. So we want to thank people for their patience with that. We also want to let folks know that we've worked on ways to get some shorter testing turnaround times at our Kmart site, because we know that that's challenging for a lot of folks.
Yeah, at this point in time, we have transitioned to a new lab locally, and they're wonderful. Our turnaround times right now are 1 to 2 days. And so again, that should be really encouraging for anyone in our community who needs testing.
Yeah, and that's for those the nasopharyngeal swabs. The saliva ones do take a little bit longer, but so people have different options depending on what they want. So I want to wrap us up by speaking to, we're hearing some people saying things like, oh, it's inevitable that everyone will get COVID, or they just want to try to get COVID to get it over with, or something like that. What would you say to those folks right now?
Yeah, that's true. Unfortunately, some people say, well, I'm just ready to give up, or, everybody has it. Maybe everybody just needs to get it. There are 2 reasons that I recommend firmly against that strategy. Number one is we're really overwhelmed at our hospitals and clinical sites. I'm a physician at KU Medical Center, and as many of you have heard, we're quite overwhelmed right now. And, of course, we're not to the breaking point yet, but we sure don't want to get there, and we're certainly edging up against that. The other reason is that remember that there are sometimes long-term consequences of this disease. It's really important to remember that if you don't get COVID, you can prevent those long-term consequences. Some of those conditions include cardiovascular disease, neurological disease, issues with taste and smell, mental health issues, fatigue, feeling foggy. So we really want to try to avoid all of that. And remember that this disease is preventable. Remember that this is in your hands. And so again, I recommend anytime you go into the public sphere, wear a mask, and a high quality mask is better. Something like a KN95 or a paper surgical mask would be great. And just remember to stick with it. I think this is the height of this wave right now. So I want to be encouraging that we will get through this, but it is a difficult time.
Thank you so much. We'll put links in the description to where people can find testing sites near them, vaccination sites near them. We'll see you folks next time.